So you're in pain, maybe it's back pain or neck pain, and you're struggling with the pain. Maybe it's becoming very difficult to get through your daily activities or your work, and you just need something very quick to reduce that pain before you get it sorted. And you're thinking, well, is it healthy? Is it okay for me to take painkillers? Or maybe you're thinking the pain isn't that bad and I can get through it, but would it help the problem if I take painkillers? Well, in this video, I'm going to answer these exact questions because this is one of the most common questions I get in terms of painkillers. So let's get started. There are generally two different types of painkillers. Those that are going to work at the local level in the area that you've got the tissue damage to reduce inflammation in the area to make you feel better. And that's going to be painkillers such as ibuprofen or naproxen, which are very common ones. Or they tend to work through the central nervous system by blocking some of the pain signals going through the spinal cord or reducing some chemicals such as dopamine in the brain to give you that euphoric effect, to give you the perception of less pain. And depending on the type of problem you have, you'll be recommended the right medication for you by either your GP or your pharmacist. And that will be the first thing I'll say in this video, is to always consult your GP or pharmacist if you're seeking medication for an issue, because they'll be able to give you the most appropriate painkillers in most cases. But what I want to talk about today is it healthy to do so, or is it okay from a health perspective? One of the primary benefits of pain is that it will tell you of any tissue damage that you have and make you aware of it. This ensures that you don't keep on doing the activity or the movement that aggravated it or caused the damage in the first place, or that you're not going to do any movements or activities that is going to make it worse and add to that tissue damage. And this is one of the best things about pain. If we didn't have any pain, it would be very problematic. One of the problems with painkillers is that it dampens the pain, reduces the pain, which gives us the perception that there isn't anything wrong anymore. Particularly if it takes away that pain, we're going to continue going through our day as if there isn't a problem, but what we're probably doing is actually making that problem worse. So if you are taking painkillers, you still have to be aware that the tissue damage is very likely still there and it hasn't necessarily recovered, and so you still need to be very careful. And this is the problem with taking painkillers, is that you very often will do things that will aggravate it. So my advice would be, if you can cope with the pain and you can go through your daily activities, then try to avoid taking painkillers or try to take as little as possible. It's certainly no benefit to take it for the sake of taking it, because it's not necessarily going to heal the tissue damage. You're still going to have the problem there. Taking painkillers doesn't get to the cause and root of the problem, it only covers it up. So this can be very useful if you're in a lot of pain and you can't cope, or you need to get through the day. Then by all means take it, and that's what it's there for. But don't take it just out of routine, because it's not going to do you any good in terms of your health. And it's always very useful to know the extent of your condition and how well and quickly it's healing. So I hope you found this very useful. Please do put any questions in the comments, and I will see you on the next video.